Hey guys, welcome to Tuesday Tidbits with the Green Bay Doulas. I'm Emily Jacobson. I'm back here with Colleen Grzinski for part 2 of postpartum breast cancer conversations. So we were just talking about what do we want to do about part 2. We can't even access mammograms until we're how old? 40?
So you can get a baseline mammogram when you are 35. But yeah, the recommendation is mammograms not till you're 40. But even with mammograms, for young adults, most young adults have dense breasts.
Mhm.
And actually, the American Cancer Society no longer recommends the checks in your OB office or self exams. They found that they
Oh my
really
gosh.
doesn't, yeah. So it really leaves a lot of people wondering what to do. Like, if you've had your first pregnancy after age of 30, family history does matter, but do know that about 90% of breast cancer patients don't have family history. So it
So it's
can,
not like going and get the gene test to see if you're carrying that gene or even just looking at family history. 90%, that's pretty crazy.
yeah. And so there, you can, I was genetically tested, but I am the third generation in my family to have cancer, and we came back clean. And actually, if you had a genetic test before 2013, they actually recommend that you come back in and get a new one just because the advances have just progressed so quickly.
So then how can people be proactive if they're like, wow, this, I had no idea. I really want to make sure that I stay healthy for me and my family. But they're not, I'm only 32 and I don't qualify yet, or insurance isn't going to cover a mammogram. Like, what do they do?
Yeah, so first talk to your doctor. Talk to them about what are risk factors that you have. So when did you have your first period, pregnancy, family history. Also, one of the great things about titcheck.org is that it talks to you about just, simply just like feel your breasts. 80% of young adults find their breast cancer themselves. I found it when I was just changing my clothes, and they actually recommend that when you're changing, just kind of feel things up. But I know a lot of women too, or people that have found their breast cancer when they're breastfeeding. So it's just really important to take the time, just kind of like feel around, but also get to know what's normal for you.
Right.
So,
I'm very fibrous. So for me, it would be a lot harder if it was smaller. I would have to have like a golf ball for me to be like, oh, because it already feels like a bunch of peas,
yeah.
you know?
Yeah, and that's where your doctor and being proactive with your doctor can come in. So I know, people that are like family members that are in the same situation, and because of my breast cancer family history, they alternate between ultrasounds and MRIs every year. So every 6 months, instead of doing the mammogram, they go in and they get the ultrasound and then they get the MRI. So it's important your doctor, again, that's all covered because, in my family, we have the family history. So, but yeah, it's not something normally covered. There's also bills right now in the Wisconsin legislature that would cap the costs and also require that if you have dense breasts, things like mammograms, ultrasounds have to be covered by insurance.
Awesome. Good to know. Well, thank you so much, Colleen. Really appreciate it. Also, I am going to link Colleen in the bottom here. So if you guys do want to reach out to her about postpartum breast cancer, she's a wealth of information and she's willing to talk about her journey as well. So thank you guys so much. Have a good one. Bye.